Hello there, and welcome. My name is Dr. Calliope, and I'm going to be performing your cranial nerve examination today. This is going to involve some special tests to assess the function of your cranial nerves. Did you have any questions before we begin? Yes. What are the cranial nerves? Well, if you have a little bit of time, we can break that down for you. Nervi craniales, the cranial nerves. We're going to have quite a bit of Latin today. So these are 12 pairs of nerves originating in the brain. These connect parts of the head, the neck, and the upper body to the brain. It is a part of the peripheral nervous system. So you have two types of nervous system sections. You have the peripheral and the central nervous system, which is primarily your brain and your spinal cord. The function of the nerves are to send and receive information. These generally, cranial nerves, originate in a nucleus or multiple nuclei. In this particular instance, this means a collection of cell bodies or neurons, which are nerve cells. And these nerves can have a sensory, a motor, or a mixed function, which means that they have both. So they can either pick up sensation, they could receive motor information, like with the muscles, or they could do all of that. This is your brain, albeit in a different sort of view than you're probably used to. This is the base of the brain, so we are looking at the bottom of it, face up. If we look at the brain in this way, the cranial nerves look as if they are very neatly arranged. However, this is a bit of a deceptive view, because if we look at it in a more classic view from the side here, then we can see the cerebrum, the cerebellum, and the brainstem here, where things are arranged a little differently. So here we have the area where most of the nuclei of the cranial nerves lies. We have the midbrain, the pons, and the medulla oblongata, also more commonly known as the medulla, and this makes up the brainstem here. And our first two cranial nerves are going to emerge instead from the cerebrum. If we look back at the base of the brain here, we can see the optic nerve tract right in here, as well as the olfactory tract right in here at the base. If we hone in, for example, on the medulla here and take a closer look at it, we can see here, for example, the hypoglossal nerve ending in the hypoglossal nucleus. We have the vagus root and the vagus nuclei, and these nerves can get pretty complicated. This is our oculomotor nerve here and the plan of the pathway of the nerve. And then we have the fifth cranial nerve here that goes all over. There's this orbital branch here. We have to the external pterygoid muscle, the masseter, the buccinator, internal pterygoids, coming all the way down to the anterior belly of the digastric, the mylohyoid. And that's not even the longest nerve, which is the pneumogastric here, more commonly known as the vagus nowadays. So we follow this, comes all the way down, and this comes into the thorax, the upper abdomen, as well as the head and neck. It's safe to say that these nerves have a lot going on. So that's what we're going to do today, is we are going to dig into them. The existence of the cranial nerves has actually been around for quite a while. We have the first reference to cranial nerves by Herophilus in Erasistratus, 335 to 280 BCE, and 304 to 250 BCE. They identified 7 cranial nerves, but unfortunately, with the burning of the Library of Alexandria, their work was lost. However, more officially, this is attributed to the Greek Roman physician and philosopher Galen, 129 to 216 Common Era, whose writings on anatomy, including the 7 cranial nerves that he identified, reigned supreme in medicine until the Italian Renaissance, where people started to add to or correct his work. However, it's not until 1778, with the work of Samuel Thomas Sommering, that we get the commonly accepted 12-nerve model. So we're going to start with cranial nerve number 1, the olfactory nerve. Nervus olfactorius in Latin. And this supplies your sensation of smell. Cranial nerve number 1 is a special afferent nerve. Now there are a couple of different classifications for the cranial nerves. We have special, general, afferent, and efferent. And we actually have visceral and somatic as well, but that's not going to be super relevant for us today. So the special kind of nerve type refers to the special senses. For example, the vision or your hearing, whereas general refers to everything else, essentially, sensation-wise. Then we have afferent and efferent. Afferent means info travels to the brain, whereas efferent means that info is coming from the brain. So we can think of special as sensory for the most part, and general as motor. And then you have the mixed nerve, which can be really any sort of combination of all of these. It can get quite complicated, actually. So cranial nerve 1 supplies special sensory information to the brain, and it innervates the nasal mucosa. And unlike most of the other cranial nerves, it does not originate in the brainstem. In order to test the olfactory nerve, I have a selection of different scents in unmarked containers, and I'm going to have you identify them. So we'll start with both eyes open and both nostrils open. Let's start something fairly easy. Let's empty out a little bit. There we go. I could just have you take a little smell of this. And what does that smell like? Cinnamon. Very Now the next one. Have you smelled this one? What does that smell like? It's ginger. There's a little bit of moisture, so we get more of these little lumpy little balls of ginger. Good. Now I'm going to have you close your eyes. And let's do this one. Right, just a little bit here. This can be pretty potent. If I could have you just take a smell of that. What does that smell like? Yes. That is chili powder. Now I'm going to have you close one of your nostrils. Keep your eyes closed. Okay. Now let's go ahead. What does this smell like? Cumin, yes. A couple of sweet smells, a couple of spicy. And if I could just have you close the other nostril. If I could have you smell this one. What did that smell like? Yes, that was garlic powder. So we had cinnamon, ginger, cumin, garlic powder, and chili powder. So looks like the first nerve is intact. Our next cranial nerve is cranial nerve number 2, the optic nerve, or nervus opticus. And this is the nerve that supplies vision. So this is a special afferent nerve sending special sensory information to the brain. And like the olfactory nerve, it originates in the cerebrum of the brain, and it innervates the retina of the eye. Our first test for cranial nerve number 2 is going to be to test your visual acuity with the Snellen chart. I am just going to have you tell me what it is that I am pointing to. So, if you could just tell me what this letter is. Good. What about right here? Here? Good. What's this number right here? And here. Good. Here. Okay. Can you read this line for me? Excellent. And what about this number right here? Okay. And this line forwards. Good. What about this line backwards? line number 9. Good. Good. Okay. Can you read this line right here? D, L, D, C, E, O. Excellent. Can you cover one eye for me? And can you read this letter? And what about this letter? Can you read this line backwards? D, C, B, O. Excellent. And what about this one backwards? Good. Excellent. And can you cover the other eye for me? Just cover the other eye. And then can you read this letter? This one. This one. And this line forward. Good. And this line forward. Excellent. And last one. Can you read this line? Oh, wonderful. Next, we are going to bring in a little light here for the direct consensual response test. I'm going to put my hand up between your eyes, and I'll be shining the light in one of your eyes. What should happen is both this eye reacts to the light, that is our direct response, but at the same time, this other eye should also react in the same way at the same time, and that is our consensual response. I'm just going to put my hand right here. We're going to look at the direct, consensual, very good, consensual. The other side, so we have direct, good, and consensual, and consensual. Wonderful. So I'm going to put this away for a moment. And we are going to do what's called the finger wiggle test. So I'm going to do a couple tests for your peripheral vision. I'm going to have you just look right at my nose here. And don't look away from my nose. I'm going to have you tell me when you see my fingers wiggle in your periphery. All right? Okay, keep looking right here. And if you could just tell me when they wiggle. Mm-hmm. Yep. Mm-hmm. Good. Yes. Mm-hmm. Yep. Good. Mm-hmm. Yes. Mm-hmm. Good. Yep. Here are a couple geese. Go good. Mm-hmm. It's that time of year for them. Mm-hmm. Good. Good. Excellent. Now, this time, I am going to cover this eye. I'm going to have you cover this eye, and I'm going to bring my fingers in. I just want you to tell me when you see my fingers come into your field of vision. So, cover this eye. cover this eye. Just tell me when you see my fingers. Mm-hmm. Good. Yep. Mm-hmm. Good. Okay. And switch to the other side. Close this eye. Mm-hmm. Good. Good. Yep. Yep. Mm-hmm. Excellent. So now I am going to just do a little blind spot test where I'm going to just bring the pen in and out, and you just tell me when you don't see the pen anymore. You'll see it kind of fade in and out. So I'll have you just cover that side and tell me when you see the pen and when it disappears. Tell me when you see it, when it disappears. You see it, when it disappears. Good. And this side, if you could cover that side. Tell me when you see the pen. Okay. Like that. Very good. Okay. Excellent. Now, lastly, for the optic nerve, we are going to be performing a fundoscopy, which means I will use this ophthalmoscope to look at the back of your eye. So this has this little wheel here. That is a magnifying lens, and I just put my eyebrow right here, and I will turn on the light. We'll look at your eye, and this allows me to see behind everything. So just flip on the light. Where am I at? And I want to be at 0. There we go. And we'll just make sure that looks good. Let's see. I need just a little bit more here. There we go. I'm going to put my hand on top of your head so that I don't run into you. And I'm going to look for what's called the red light reflex. So your eyes will appear red. It's like old photos where you'd have the red eye effect. There we go. And just come in closer. There we are. So what I can see here is the optic disc of the optic nerve, as well as the macula, the fovea, and the blood vessels. Just taking a little peek here, making sure this all looks normal, color's normal, aren't any shadows, anything like that. And the other side. Let's see, so red light reflex, just had it. Sometimes it can be a bit tricky. There we go. So we're going to come in real close and take a little peek here. Just making sure everything looks good here. We have the optic disc off to the side, on the nose side, and then the macula right in the center. And I can't exactly, the fovea is a little, it's part of the macula, but it's not easy to see. Okay, and the blood vessels out of that channel there. And there we go. So we're going to move on to a big group of nerves. So our next group of nerves is kind of a lot. These are the nerves that govern eye movement. we have cranial nerve number 3, oculomotor, or nervus oculomotorius. We have cranial nerve 4, the trochlear nerve, nervus trochlearis, which is the ancient Greek and Latin word for pulley. That's what trochlearis is. Then we have cranial nerve 6, the abducens nerve. This is nervus abducens. So these all are general efferent nerves. Number 3 originates in the midbrain as well as number 4, whereas number 6 originates in the brainstem. So cranial nerve 3, formerly the motor oculi nerve, this controls a whole lot of muscles. We have the inferior oblique, inferior rectus, superior rectus, levator palpebrae, the internal rectus, the iris sphincter muscle. So think of that as the muscle that allows your pupil to get larger or smaller. And the ciliary muscle, which allows accommodation. That's the ability for your eye to focus at different distances. So if you look at something far away, look at something up close, most likely it's pretty clear with both images, and that is thanks to the ciliary muscle. The trochlear nerve here, we have the superior oblique muscle. This allows you to look downwards and inwards, while the external rectus muscle here allows you to look outwards. So for the oculomotor, trochlear, and abducens nerve, we are going to start by looking at your pupillary response. So I am going to have you just look right here at my nose, and I'm going to bring my light in. We're going to make sure that the eyes react in a way that is simultaneous, like the direct consensual response test. We want the pupils to be equal and round and reactive to the light. That's our little acronym that we need to keep in mind. PERRL. Good. Just keep looking at my nose. Making sure the pupils dilate and constrict in response to the stimulus. There we go. Good. This is your iris sphincter muscle that controls the size of the pupil. Good. And then for our ciliary muscle, for our accommodation, I am going to have you look at the light right here and follow it as it comes in and out, right? Just tell me if there's anything odd about your vision as you do that. So we're just going to come in and out, in and out. Good, in and out. Excellent. And right over here, keep following this light. And out, and in, and out, in and out. Excellent. Okay. So now we are going to do the swinging light test, and this tests for an efferent defect in the eyes. Remember, that's info coming from the brain. So I'm just going to have you again look right here, and I'm going to bring the light up here, and then right here, and then right here. We're just going to watch your eyes react as we go back and forth with the swinging light test. In Good. Okay. So we're going to put away the light for just a moment. I'm going to have you look at my fingers here, and I want you to follow these fingers. We're going to test all those muscles that control the eye movement. So how we do that is called the H test, which I'm just going to be bringing my fingers in an H shape. Keep following these using only your eyes without moving your head. Up, down, center, up, down, center, up, down. Good. Then I'm going to have you follow this up and down. We're going to look for any lid lag here. Up and down. Up and down. Good. Now diagonally up. Diagonally down. Diagonally up. Diagonally down. Diagonally down. Diagonally up. Diagonally down. And diagonally up. Just like that. Good. So we will bring in our light again, and this time I'm going to look for what's called the corneal light reflex. So if I hold the light in front of your eyes like this, the light should reflect off the eyes in the same place if they are aligned. If one is out of alignment, then there's going to be a difference in the light reflection. So I'm just going to hold this right here. Just look straight ahead at my nose. I'm just going to make sure that the light is reflecting in the same place. Good. Okay, that looks good. So I am just going to cover one of your eyes, and we are going to watch how the eye that is uncovered reacts. Sometimes if there's something goofy when you cover one eye, the other one doesn't really know what to do, and you get a little bit of, well, goofiness. So I'm going to cover one eye here. And you just look straight ahead. I'm just going to look at this eye. Just observe it for a little bit, see if there's any deviation. Okay. Good. The other side. I'm just going to cover this eye. Then I'll look. Just watching. Make sure that it all looks good. Okay. Excellent. Cranial nerve number 5, the trigeminal nerve. Nervus trigeminus, which means the triplet nerve, formerly known as the trifacial nerve. This nerve governs facial sensation and the ability to chew. So this nerve has 3 branches. The upper 2 are going to be sensory only, and the lower third is going to be motor and sensory. So this is quite a mixed nerve, and it originates in the brainstem. In terms of sensory aspects, the cranial nerve number 5 deals with the sensation in the face, the mouth, and the temporomandibular joint. But we've got a lot going on in the motor section. So we have the masseter, temporalis, and lateral pterygoids. These are your chewing muscles. We have the tensor veli palatini, which assists with swallowing and yawning. We have the mylohyoid, the anterior belly of the digastric muscle, and the tensor tympani muscles in the ear. So we are going to start with the sensory part of the trigeminal nerve. So we have the three branches. This is the ophthalmic up here, the maxillary right in here, and the mandibular right in here. So it kind of forms a three. Trigeminal, three branches here. So I have a cotton bud and a little pointed tip here. So as you can see, it's not so sharp that it's going to break the skin. It's just going to be a pointed sort of contact. So I am going to either touch you with the soft or with the sharp touch. So I'm going to test these on your cheek here, if you don't mind. Okay, so this is soft. Right? This is sharp. Okay? So I'm going to have you close your eyes, and you just tell me soft or sharp, right? Okay. Sharp. Sharp. Soft. Soft. Sharp. Soft. Sharp. Soft. Sharp. 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 Wonderful. So I will have you open your eyes, and now I am just going to check the masseter and the temporalis muscles. So these are the more superficial muscles of mastication or chewing. We don't need to get into the pterygoids. So I'm just going to palpate around the masseter here. I'm going to have you clench the jaw, unclench, clench, unclench. Good. And can you open the jaw? Open and close that. We'll get the temporomandibular joint in there. Open, close, open, close. Good. Now for the temporalis here, along the sphenoid bone, I'm going to have you clench the jaw, unclench, clench, unclench. Good. One last little test, which is kind of funny in that we're looking for no result at all, is called the jaw jerk reflex. I'm going to have you slightly open your mouth, and I'll put my thumb right in the divot of the chin there. I'm going to use my buck hammer here and tap on my thumb. What should happen in a normal response is nothing at all. All right? So I'm just going to have you open your mouth slightly. I'll put my thumb right here. We're just going to real easy. So we'll move on to the facial nerve. Cranial nerve number 7, the facial nerve, nervus facialis. This governs your muscles of expression, as well as gland secretion, like the submandibular glands and the sublingual glands, as well as taste for the anterior 2/3 of the tongue. So that would be the front part of the tongue. This is an extremely mixed nerve. There are all kinds of combos of special, general, afferent, and efferent functions in this nerve. It's got a lot going on. And it originates in the pons, which in Latin means bridge. So for the facial nerve, even though there are a few different nerves involved in the sensation of taste, we are going to go ahead and just do that now. So I'm going to use a very small amount of taste so that I don't overwhelm you. I have some unmarked containers. Just a little bit in here. Okay. Right. And I'm going to have you stick out your tongue. Okay, and we're just going to just put a little bit on your tongue there. Tell me what that tastes like. Yep, that's garlic. And the next one. Do it on the other side here. All right, and right here. What does that taste like? I had to give you something a little spicy. I tried my best to do the littlest bit, but that's our chili powder. Okay, other side here. Get this one. This is also just a tiny bit. What does that taste like? That's our cinnamon. Good. Went ahead and with that one ended with our sweet rather than start with it. So now we are going to test your expressions, all the muscles of expression. So I'm going to have you smile real big for me. Good. And can you show your teeth while you smile? Okay. Can you puff out your cheeks? Excellent. Can you close your eyes real tight? All right, I'm going to try to open them. Don't let me keep them shut. Good. And can you raise your eyebrows? Both of them. Can you raise one eyebrow? The other? Not me, not so much. Okay, so that looks good. And next we're going to do the 8th cranial nerve. Cranial nerve number 8, the vestibulocochlear nerve, is a dual nerve, nervus vestibulocochlearis. This is formerly known as the acoustic nerve or the auditory nerve, and it governs hearing and balance. So we have the vestibular nerve, which is our balance and motion, and the cochlear nerve is for hearing. So this is a special afferent nerve, and it originates in the pons. We're going to do a few different kinds of hearing tests for the vestibulocochlear nerve. First, I'm going to have you repeat what I say. I'm going to say a few things. You just repeat them back, all right? Okay. Coconut, concrete, stoplight, furnace, carpet. Okay. And was that easy to hear? Good. Now we're going to up the difficulty a little, and I'm going to have you repeat what I say, but this time it's going to be whispered in your ear. Okay? All right, so I'm just going to try to cover this here a little. Apricot, orange, peach, apple, blueberry, raspberry, kiwi, rhubarb, persimmon, banana, kumquat, mango, lemon, lime, starfruit, yuzu. Okay, and how was that? Wasn't too bad? Everything came in loud and clear? Or quiet and clear, rather? Good. Okay. So now we have the Weber and Rinne test. I'm going to use a 512 hertz tuning fork for this. So what this does, when I strike it like this, it vibrates the sound between the forks. That's what makes the tone. Like that. For the Weber and Rinne test, I'm going to strike the tuning fork and put it right on your forehead. You just tell me if it sounds louder in one ear, the other, or if it's right in the middle. Then I'm going to strike the tuning fork and put it on the mastoid process behind the ear, the little bone behind the ear. And I'm going to have you tell me when the sound stops. When it does, I'll bring it in front of the ear, and you tell me when it stops after that. Right? Pretty easy. Let me get my little striker. This is just a little rubber mallet on a stick here, but it's much easier than doing this all day long. A little easier doing this. So I am going to strike the tuning fork and put it on your forehead. Do you hear it more on one side, the other, or right in the middle? One side, the other, or right in the middle. It might be a little soft. Good. Now for behind the ear and in front. Tell me when you no longer hear the sound. And tell me when it stops. Okay? Tell me when you hear it. When it stops. Tell me when you hear it. When it stops. Okay? Okay. Do you hear it? Stops. Okay. You hear it? Good. Okay, excellent. Now, the last one, I'm going to have you get up for just a moment because I'm going to need to test your balance a little bit. I already saw you come into the office, so for the most part it looks like you're all right, but I just want to make sure. I'll have you stand up. I'm going to have you put your arms out to your side, close your eyes, and march in place. I will be right here to make sure that you don't tip or that you don't fall. Just do your best to hold your arms out to your side, eyes closed, marching in place, all right? Okay, we'll do that just for a little bit. So, eyes closed, side to side, and 2, 1, 2. Good, just marching in place. 1, 2. Okay, that looks good. You can go ahead and stop. We'll move on to the next nerve. Cranial nerves 9 and 10 are often tested together. We have the glossopharyngeal nerve, or nervus glossopharyngeus, something like that. And then we have number 10, the vagus nerve, which means the wandering nerve, and this is nervus vagus. So the wandering part of the vagus nerve, and this is kind of a very small list of what it can do. So it threads through the neck, the thorax, and the upper abdomen. It has a role to play in a lot of different things. We have phonation, we have taste, so it's also like your heart rate too. It's part of your parasympathetic nervous system. And with the glossopharyngeal nerve, this helps with swallowing, salivation, taste, and oral sensation. These are very mixed nerves with our combos of special, general, afferent, and efferent functions. And these originate in the brainstem. So luckily, even though the glossopharyngeal and vagus nerves have different sort of functions, and the vagus nerve does so much. I mean, you have gland secretion, it does have a part in taste and sensation and phonation as well. We can still test them together. So first, I'm going to have you take a dry swallow for me. Just like that. Okay, wonderful. And then I'm just going to have you cough real quick for me. Just a I'm sick. Okay, good. Now I'm going to grab a clean tongue depressor. We're going to look at the soft palate at the back of the throat, or back of the mouth rather. And we are going to look at the uvula. So, if I could have you just open your mouth. Yep, real wide for me. Stick out your tongue. There we go. I'm just going to put that right there. And let's take a little look right up there. So we have the hard palate, which you're probably pretty familiar with. Your tongue touches it all the time. That's the roof of your mouth, but the soft palate you can probably reach if you pull the tongue way back. It's very squishy in there. That's why it's the soft palate. Okay, and as for the uvula, that is midline. So I'm going to have you say ah for me. There we go. Good. Okay, and go ahead and close your mouth, and we'll look at the accessory nerve. Cranial nerve 11, the accessory nerve, nervus accessorius, is kind of a weird one. So this one definitely innervates or supplies nerves to the sternocleidomastoid and the trapezius muscles in the neck, back of the neck, and it's definitely an efferent nerve. but it might also innervate the laryngeal muscles. It might be a special nerve. It might be a general nerve. We're not exactly sure. We know more about the spinal part of the accessory nerve because it originates in maybe the brainstem, but it definitely also originates in the spinal cord. So I'm going to take a look at the sternocleidomastoid and the trapezius. So your trapezius comes a little bit in front, but mostly it is in the back. It is a trapezoidal shaped muscle. And the sternocleidomastoid is a real big muscle in here, real thick, real corded on some people. So I'm just going to have you turn your head for me. Okay, we're just going to look here at the muscle. Just inspect this side. Good. And the other side, if you could just turn your head. Right here. Good. I'm just looking right here and doing a little bit. Not exactly palpating, but just feeling the form. Good. And you can go ahead and hold your head in a neutral position. Let's take a look at trapezius. I'll palpate a bit. This is the one that if you have a lot of neck pain, that's your culprit generally. It gets all knotted up, all tied up. Okay. Good. All right. So now we're going to test the shoulder movement and the head and neck range of movement as well. If I can have you shrug your shoulders. It's probably one of the easiest nerves to test for that reason. Good. I'm going to try to hold your shoulders down. I want you to push up against me. Okay, I'm going to try to push down. You press up. There we go. Good strength. Now I'm going to move your head around, okay? So I'm just going to have you go up and down, up, down, okay? Side, 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 tilting to one side and the other. Okay, tilting to one side and the other. There we go. And how was that? Did that feel okay? All right, and would you mind just doing that yourself? So going up and down, up and down. Okay, looking to one side, the other, one side, the other, and then tilting your head to one shoulder, the other, one shoulder, the other. Excellent. Does it feel like there's any pain or restriction at all? No. All right. Our last nerve is cranial nerve number 12, the hypoglossal nerve, nervus hypoglossus. This nerve allows us to move our tongue. It is a general efferent nerve, and it originates in the brainstem, and it's also a very easy nerve to test for function. So our last test is going to be the most challenging of our tests. I'm going to have you stick out your tongue, and I'm going to have you move it to one side, the other, up, and down. And that's it. I mean, you can move it all around a bit if you want. That's up to you. I'm not going to do that. All right, excellent. And that will conclude our cranial nerve examination. Let me just take a look. Make sure. Everything else looks good. Okay, everything looks great. Did you have any last questions for me? Okay, so we got it explained well enough for you? Wonderful. I'm just going to sign off real quick. And that'll about wrap it up. I'd like to thank you so much for cooperating with this cranial nerve examination. You were a wonderful patient. I hope you have a whale of a day and a good rest of your night. Thank you.